Going into a hospital to give life and never making it back home. Not because the situation was unavoidable, but because warning signs were ignored. Now, imagine that this happens far more often to a specific group of people. That's exactly the reality behind a powerful piece of legislation being reintroduced in the United States, the Kira Johnson Act. And today, we're breaking down what it is, why it matters, and how it could change the future of maternal health care. Congresswoman Alma Adams has officially reintroduced the Kira Johnson Act, a bill aimed at tackling one of the most alarming healthcare issues in America, maternal mortality. She's joined by Senator Raphael Warnock, and together, they're pushing for stronger accountability in healthcare systems, especially when it comes to pregnancy and childbirth. But this bill isn't just policy, it's personal. The legislation is named after Kira Johnson, a woman whose tragic death shocked the nation. After giving birth, Kira reportedly showed signs of internal bleeding, but for over 10 hours, medical staff allegedly failed to act. By the time action was taken, it was too late. Her story has since become a symbol of something much bigger: failures in the healthcare system, gaps in accountability, and a harsh reality many families face. According to Alma Adams, it's been 10 years since Kira's death, yet the situation hasn't improved nearly enough. Black women in the United States are still 2 to 3 times more likely to die from pregnancy-related complications than white women. Let that sink in for a moment. Even more shocking? Experts estimate that about 80% of maternal deaths are preventable. That means most of these tragedies shouldn't be happening at all. Adams has described this as not just a healthcare issue, but a preventable public health crisis. So what exactly is this bill trying to change? At its core, the Kira Johnson Act is about accountability and protection. One of its key proposals is the creation of respectful maternity care compliance programs. In simple terms, this means hospitals and healthcare systems would need to follow stricter standards. Patients would have formal ways to report neglect, bias, or poor treatment. Complaints wouldn't just be ignored, they'd be tracked and addressed. This is huge because right now, many patients feel like their voices aren't heard, especially during vulnerable moments like childbirth. Another major focus of the bill is tackling implicit bias and systemic racism in healthcare. This includes training healthcare providers to recognize and reduce bias, improving decision-making processes during pregnancy and postpartum care, and supporting community-based organizations that work directly with affected populations. Senator Raphael Warnock has gone as far as calling maternal mortality disparities a moral stain on the country. And in states like Georgia, the risks for Black women are significantly higher, raising serious concerns about how healthcare systems are operating. From a legal perspective, this bill could be a game changer. While it doesn't introduce any new criminal penalties, it really does strengthen compliance requirements for healthcare providers. So what does that mean? Well, hospitals could face a lot more scrutiny. There may be more pathways for patients to file complaints, and healthcare institutions could face increased civil liability if standards aren't met. In other words, the system would no longer be able to just overlook these issues without consequences. The Kira Johnson Act is definitely not standing alone. It's actually part of a broader legislative effort known as the Momnibus, which is a package of bills designed to tackle maternal health disparities from so many different angles: legal, medical, and social. And behind this movement are not just lawmakers, but also advocates and families who have experienced these tragedies firsthand. One of the strongest voices is Charles Johnson, Kira's husband. He founded the advocacy group For Kira for Moms to push for change and make sure that no other family has to go through what his did. He described the bill as a meaningful opportunity to turn advocacy into real, enforceable standards. The bill already has support from multiple lawmakers, but its future isn't guaranteed. Like all legislation, it has to go through committee reviews, debates, and negotiations around healthcare policy, Only then can it move forward. But one thing is clear: the conversation is changing. There's a growing push to make accountability, equity, and patient rights a permanent part of maternal health care. At the end of the day, this isn't just about policy, it's about people. It's about making sure that bringing life into the world doesn't come with preventable risks. And it's about ensuring that stories like Kira Johnson's are never repeated. Let me know your thoughts in the comments. Do you think this bill will make a real difference? If you found this breakdown helpful, make sure you like this video, share it with others, and subscribe to the channel for more content that breaks down important stories like this clearly and engagingly. Thanks for watching, and we'll see you in the next video.